Assessment of the pleural space and lung. This section of the curriculum on general critical care ultrasonography will review the ultrasonographic assessment of the pleural space and lung. Multiple aspects of the goal-directed examination of the pleural space and lung will be reviewed in this tutorial. Achieving competency in the focused assessment of the pleural space and lung requires integration of technical skills, that is, image acquisition, with cognitive skills or knowledge base that are image interpretation and clinical applications. Lung ultrasound can be routinely performed at the bedside by the intensive care unit physicians and may provide accurate information on lung status with diagnostic and therapeutic relevance. Interpretation of the images obtained by ultrasonography is based on the identification of structures and understanding of artifacts to visualize normal and abnormal lung and pleura. The advantages of ultrasonography in the ICU is the rapid bedside diagnosis of various conditions, including pleural effusion, pneumothorax, atelectasis and consolidation, and pulmonary edema and other interstitial syndromes. In order to use ultrasound in a safe and efficient way, to assess for pleural effusion, to guide thoracentesis, and to assess the lung for various pathological conditions, the bedside sonographer will need to be competent not only in identifying pleural fluid and lung, but also in knowing the general principles of thoracic ultrasound, the anatomy of the surrounding structures and organs, and the clinical correlates and applications of the technique. In order to avoid overdiagnosis or underdiagnosis of disease or conditions, the bedside sonographer needs to be aware of the limits of their competence and of the limits of the modality. The three critical components of ultrasonography are image interpretation, clinical applications, and image acquisition. This tutorial will provide the participant with cognitive skills and knowledge covering image interpretation and clinical applications. It will also cover in details the technique used to perform image acquisition. Remember that to become competent in acquiring images and guiding needle insertion, a good amount of practice under expert supervision will be required. This curriculum will be divided in two courses. The first course will go over the ultrasound assessment of the pleural space for effusion, and the second course will go over the ultrasound assessment of the lung. Course 1. Ultrasound assessment of the pleural space for effusion. The general learning objectives of this tutorial are to know the general indications for pleural ultrasound, to identify the sonographic anatomic landmark of the normal chest, to learn how to assess simple and complex pleural effusions, and to learn how to use ultrasound to perform thoracentesis. The learning objectives and content of this tutorial cover in details the requirements for competence in pleural ultrasonography, as described in the American College of Chest Physicians and Société de Réanimation de Langue Française Consensus Statement on Competence in Critical Care Ultrasonography, published in the issue of April 2009 of the journal Chest. The participant is strongly invited to refer to this important document. Table 1 of this document provides a detailed list of the technical and cognitive elements required for competence in pleural ultrasonography. These elements will be covered in this tutorial and will require that the bedside sonographer be able to proceed with identification of a relatively hypoechoic or echo-free space surrounded by typical anatomic boundaries, diaphragm, chest wall, ribs, visceral pleura, normal, consolidated, and atelectatic lung. Identification of liver and ascites, spleen, kidney, heart, pericardium and pericardial effusion, spinal column, aorta, inferior vena cava. Identification of characteristic dynamic findings of pleural fluid, such as diaphragmatic motion, floating lung, dynamic fluid motion, resporophasic shape change. Characterization of fluid, anechoic, echogenicity, using the liver, spleen as a reference, homogeneous or heterogeneous, presence of strand, debris, and septations. Identification of miscellaneous findings such as pleural-based masses or thickening. Performance of semi-quantitative assessment of fluid volume. Recognition of specific limitations of ultrasonography to identify pleural fluid, such as inadequate image quality due to technical limitation, subcutaneous emphysema, hemothorax, echo-dense purulent fluid, mimics of effusion such as mesothelioma or pleural fibrosis.